Hello, everyone. I'm Raymond Cross from the University of Maryland School of Medicine, and today we're going to talk about vedolizumab, the commercial name for which is Entyvio. So vedolizumab is an anti-integrin biologic. So what's an anti-integrin? Integrins are molecules on white cells that will attach to areas of inflammation in the intestine. So what vedolizumab does is it blocks that interaction between the white cells and the intestine, and thereby decreasing inflammation. So I'm from the Chesapeake, so I like to use a boating analogy. So the boating analogy is your white cells in your body are the boats, and your intestines are where the dock is. And what vedolizumab does is it doesn't let the boats dock in the intestine. This is a biologic that's currently only given intravenously or through an IV. It's given at week 0, week 2, week 6, and then the standard maintenance dose is every 8 weeks, although some patients need to receive this more frequently. This drug is what we call gut specific. So it only targets the immune system in the gut. So in that way, this is a completely novel medication that we haven't had before for the treatment of both ulcerative colitis and Crohn's, for which this drug is indicated. The other nice thing about this drug is it tends to be very safe. So in theory, because it is affecting the immune system in the gut, there may be a higher rate of gastrointestinal tract infections, although in clinical practice, we've not really seen this. It is given through an IV, as I mentioned, so you can have an allergic reaction to the infusion, which is quite rare. And I haven't seen one of those in years since I've been prescribing this medication. And also in the clinical trials, there was some concern about abnormal liver enzymes in patients using this drug. And in clinical practice, we haven't really seen that. So this tends to be one of our safest drugs that we can give, and it is effective. One of the things to consider in any therapy is how fast is this drug going to work? So when am I going to feel better? So because of this mechanism, we thought for a long time that this would be a slower onset of action drug. And indeed, it is slower than some of the existing therapies we have for treatment of Crohn's and colitis. But that was probably, we probably overestimated the amount of time that patients need to be on the drug to see an effect. And in fact, really within a few weeks, patients should feel better. Certainly by that third infusion at week 6, you should be feeling much better. There is a injectable product that's coming soon that will be used after the induction therapy. We just do not have that approved in the United States yet. So thank you for your attention regarding vedolizumab or Entyvio.